Hi, it's Satoru from hariQ Acupuncture Nerves. In this video, I'm going to show you how to release and ease acute low back pain all by yourself. Sometimes when you lift heavy objects, sneeze, cough, or even wake up in the morning, your back can suddenly give out, making it difficult for you to wake up, stand up, or even stay in one place. There are a lot of causes of acute low back pain, but these times the low back pain is not caused by the herniated disc, spinal stenosis, and other spinal disorders. These techniques will help you to move more easily, to get up, walk, and sleep so you can heal your back more quickly. So acute low back pain is that sudden onset of a pain or muscle spasms in the lower back that can last for a few days to a few weeks. It's usually caused by things like lifting heavy objects, sudden movements, or poor posture. It's kind of like having a sprained ankle in your back, making it tough to move around, stand up straight, or sit comfortably for a long time. Why does your low back pain suddenly hurt? Back pain can often appear suddenly without any obvious cause, leaving you with no choice but to take a painkiller medicine and rest. As a licensed acupuncturist, I have treated many patients suffering from acute low back pain or spasms and have realized that these individuals often have a tightness in their pelvis and limited spinal movement. The importance of the movement of the pelvis and the spines. When you walk, your back moves and twists it consistently. According to the article, normally the human body's lumbar spine L3 to L5 tilt to the left and right 6 to 10 degrees and the pelvis tilt 4 to 5 degrees. Once you lose this movement, put pressure on one side and cause back pain. One possible reason for experiencing limiting the movement is a tightness in the rib and thoracic spine, which can affect the trunk movement and the breathing. Restricted movement in the area of the pelvis cause quadratus lumborum muscle to become tight and cause pain. The techniques I will demonstrate to manage acute low back pain involves increasing and supporting this movement at the pelvis and the 12th vertebra to release the pain in your back instantly. It is gentle, but please be aware that you assume your own risk. Suppose you suspect that you have a severe back pain. In that case, it is advisable to seek advice from your primary care doctor or the specialist. And step 1, let's get started with a simple exercise to help alleviate some of the pain in your back. First, have a seat on a chair and make sure to sit up straight. Next, place your hand on the pelvis and then gently move the skin towards the rib on the side of the back that is bothering you. Now, take a deep breath and slowly lean forward at about 30-degree angle while exhaling. Don't forget to keep your hands on the back as you lean forward. Repeat this exercise 10 more times and make sure you feel better. And step 2, stand up and place your hand on the lower rib, especially at 12th rib. The QL muscle is often the culprit of acute low back pain, causing a tightness and the muscle spasms. This muscle attaches to the 12th rib to the pelvis. To locate the 12th rib, place your hand on the waist and find a small depression, which is most likely the tip of the 12th rib. Hold on the rib, then twist your trunk towards to the painful side of your back while exhaling for 3 seconds. And repeat this movement 10 more times. And step 3, if you have completed the previous 2 exercises that feel better, you can try the next one. Lie on your back on the floor and place your feet on the wall. Make sure you use the feet to lift up your hip. It is important not to use your back muscle to lift up your hip. To check if you use your feet or not is simply touch your thigh. If your hamstring muscle is activated, you can feel the muscle tight up. When you activate your hamstrings, which in turn activate your hip, this causes your pelvis bone to posteriorly tilt, deactivating your back muscle and alleviate your back pain. After that, extend your arm in front of you, then reach your right arm up towards the ceiling and hold this position for 6 seconds and then relax. And repeat this exercise 10 more times. And heat therapy. I know it is very painful to deal with acute low back pain, and because this muscle strain, give at least 2 weeks to reduce the pain. Meanwhile, I want you to put heat at least 20 minutes every day to increase the blood flow. You can also put icy hot or tiger balm to even increase the circulation and soften the tissue and reduce the pain in your low back. Performing these 3 steps acute low back exercise can help speed up your healing process and alleviate excruciating pain. But if you are still experiencing trouble with your lower back, you may want to consider alternative treatments such as acupuncture to expedite the recovery process. I hope this helps you or your loved one from low back pain. Take care. Bye.